Welcome back, everyone. Well, it's a subject that no one really wants to talk about, but it's so necessary to discuss, and that is the end of a pet's life.
It is tough. When is it time? How do we talk about it with our children?
And maybe you didn't know about special remembrances that you can get of your pet.
These are all things Scott discusses with Dr. Andrea Dennis for our Better Vet.
Take a look.
All right, Dr. Dennis, how are you?
I'm terrific.
Nice to see you. We're talking today about a topic that people really don't like to talk about. People love to get puppies, they love to get kittens, and then they love to talk about their pets through their lives. But unfortunately, that day does come where the pet moves on.
Right.
We have to make a decision. When is it? It's such a hard decision. Can you help us a little bit with that?
Sure. And I think the veterinarians know medically when it's time, but we try to guide you, the owner, the pet owner, when it's right for the pet, when they're tired, when they seem like they're withdrawn from the family, and sometimes they'll lose their appetite. Those are some of the guidelines that we use most frequently. If they go off in the closet and you find them, that's where they are, then you know they're really giving you a message that it's time.
You know, people hang on for their pets, I think, more for them than they do their pets.
Absolutely, and that's dangerous and that's selfish. You know, and when people go, well, I can't do it, I can't make this decision, it's not fair to the pet, and the opposite is actually true. It's not fair to let them suffer, whether it's pain, whether it's just, I'm just so weak, whether it's nausea, it's not fair for them. And again, if they could speak to us, that's what they would tell us.
Exactly.
And actually, my grandmother, who died of pancreatic cancer, the day she died, she said, don't make me eat. She told me that, and I'm like, that's what my patients tell me all the time. So I thought that was very emotional, but at the same time very telling.
How do we handle children?
Children can be tough, and I always leave it up to the parents, but again, like most veterinarians, we try to guide. I never ever want people to lie about the fact that they just went away, or they ran off, or that they, rather than telling them the truth about them dying. The issue of euthanasia, that's a little bit more difficult, and when we talk about euthanasia, that's the actual act of making the decision. We're actually injecting some medication that actually stops the heart and starts the breathing. But children don't really understand that, and that can be very scary. Even with my own animal, one of my dogs, I told my son that our dog died here at the hospital. Warned him before he went to school that the dog was very, very sick. And then when we picked him up from school, we let him know that he died. Did he want to come and see her? And he said yes. Absolutely. Yeah, he was like in second grade, but he came.
So give your kids some choices.
Absolutely. And make sure that they know what's going on. And don't be afraid to hide your grieving. And
speaking of choices, you have a choice when you come with that animal to the vet. You can either be in the room with them, or tell us a little bit about that decision.
That's also, it goes through stages. Most veterinarians give a sedative first to the patient. And some people decide at that point, when they're sort of like in a plane of anesthesia, but they're still with us, that's when they cannot be there. That's when they're ready to leave. But in this day and age, most people want to stay. And I think they feel like that's their last gift to their animal, that they can be by their side. We allow them to pet them, talk with them while we do what we have to do. But it is a personal decision, and sometimes one spouse will stay and the other one will leave, or sometimes the children stay and the parents leave. So I always leave it up with them.
You get a gift. You know, if you do certain things, talk to us about this that you can walk away with.
Right. Some of the remembrances, even people will ask in the room if we can take a little bit of fur, because usually you have to shave at the time of the euthanasia, and we'll send the fur home right with the owners before they've had anything else done. The other thing is how you bury the animal. Okay, many times there can be burials, there's cemeteries, there are pet cemeteries that is pretty expensive. Most people will have the ashes come back, or what we call the cremains.
And those are mine, from Charlie.
This is Charlie, you know, and again, we have our fur here too, and I think you can then make the decision what you want to do with her ashes. Some of my ashes of my pets are in my garden, you know, and some of them my favorite state forest. I think some people also think about wanting to bury them at home, and many towns don't allow you to do that. Also, also, too, with a lot of our patients, we'll also do the paw print. And I love having an imprint of the paw print, like that, because I love just touching it. I love just having, as I'm working with my pets, that's Charlie's foot.
That's Charlie's foot.
And she had the sweetest little foot.
But it's, and talk to us about that hotline. There is a hotline available to people.
Yes, there's several different ones out there for pet loss and bereavement, but I really do like the one that's associated with the Washington State School of Veterinary Medicine. And not only do you have people that understand, because it's run by veterinary students, but they've had training in bereavement, they've had training with counselors, and it's there for the taking.
Is it a number to call before you put the pet down, or after, or for both?
It can be both, but most of the time it's after. Because people
just to talk.
Just to talk, because sometimes not everybody understands what you're going through.
Right.
Maybe some friends and family, but people really do they go through the stages of grief. Sometimes they're angry, sometimes they feel guilty. You have to allow people to grieve and have that time to grieve too.
And just because, you can't listen to those people, it's just a pet.
They're family members now. And even one of the differences, when I first started practicing veterinary medicine, most people would just say, I'm going to drop them off and I'm leaving. Not anymore. I would say 95% of people actually stay with their pets. People have really embraced their pets as family.
Listen to your veterinarian. They know what they're doing.
Yes, and we can guide you. And I will give you one piece of advice. I have never had anyone make the decision too early, but I have had them wait too long. And they have even admitted it after the fact. When they take pictures, as they're getting weaker, or they just know the end is coming, and they'll say, I looked at those photographs and I didn't realize how bad they really were. Because you think you're doing it for them, just promise you do it for the pet, not for yourself.
Thanks for your time.
No, thank you.
Oh, some great advice. Well, the number to the bereavement hotline that Dr. Dennis mentioned is 866-266-8635, and that will connect you with the Washington State School of Veterinary Medicine. It's a hotline, and they can help you if you just want to talk.
Yeah, I think it's wonderful that they've created such a personalized service to the experience of losing a pet, because you really are losing a family member.
Absolutely.
So we'll be right back.